It is very important to encourage our nation to unite in the fight of our life hardships. I must emphasize that life is a long journey with with ups and downs, lessons, joy and sorrow, celebration and commemoration, success and failure, happiness and sadness. It is unfortunate that there are no shortcuts in life to skip some of the hardships time in our lifetime journey. I want you to take note of that. It is therefore important to understand that in this life journey, we need other. We need love. We need support. We need all in all a word of encouragement to overcome the obstacles in our life. I can see the younger people here, and sometimes it's very shocking when you hear of a suicide of a 9-year-old daughter or son. When I was growing as a child, I never heard people commit suicide. And in our republic, we have a record of a 90-plus-year-old Namibian committing suicide. And now you ask yourself a question, why? We have so many questions to ask ourselves, why people are committing suicide. Maybe the research, we need to do the research to find out who was the youngest person to commit suicide in Namibia, at what age? And then the oldest person to commit suicide at what age? And I think that will give us some idea, to dig deeper and find out what are the root causes.
According to the World Health Organization, every 40 seconds, one person dies by suicide. With Namibia being one of the countries with a high number of suicide cases becoming a sad reality, the Coma Suicide Prevention Task Force aims to curb deaths by suicide by creating awareness, educating the public, and connect with people to get assistance when the need arises. The Deputy Minister of Health and Social Services notes that Namibians should start by talking about their problems and seek professional help when feeling depressed or suicidal.
The aim of this day is, of course, to create a platform to raise awareness on the prevention of suicide, as well as to promote preventative measures with the aim to reduce the number of suicides and suicide attempts globally. Action is very important because sometimes we observe changes in the behavior of a family member, but we turn a blind eye. We make as if we don't see that. And then the next moment is either we lose that person or there is an attempt. So action, whether small or big, is very important. We need to give people the confidence and empower them to take action.
The chairperson of the Coma Suicidal Prevention Task Force said that since the establishment of KSPT in 2020, they could not do much work due to the COVID-19 pandemic. However, now that the COVID-19 cases are on the decrease, they will soon roll out awareness campaigns and society prevention workshops within communities.
Our activities has been on hold due to COVID-19, as I said. But since the situation is stabilizing, we will continue with our plan to conduct information sharing activity with communities, activities with our schools, provide information on suicide prevention to the survivors of suicide loss, and those that attempted suicide or feeling suicidal. Conduct trainings on suicide prevention with various professionals, such as healthcare workers, wellness officers, life skills teacher, police officer, etc. We will continue share information on suicide prevention via media presentations. We will continue networking with the rest of stakeholders, NGOs, ministries, or whoever in Commerce region.
Namibians are further encouraged to unite against suicide and offer support to those in need.